Are you confused by the health care reform going on in Washington? Just about everybody seems to be. That's why a group in Scranton organized the reading of more than 1,000 pages of the bill that is currently being debated.
On the payment rates for similar services in providers under Parts A and B of Medicare.
Some big words for a little person, but 9-year-old Willy Jones volunteered to help a long list of grown-ups wade through the bureaucrat speak that is House Resolution 3200, the legislation that's intended to craft health care for all Americans.
Well, I think it's supposed to help people get health care more affordable so they could afford it and get health care. My mom is a single parent and she doesn't have health care, so I just wanted to try to help her afford it and everybody else out there that doesn't have health care. Amount for contingency.
Willie's mom, Pam, teared up with pride as her son read the public option portion of the 1,000-plus page bill. Like millions of other families, theirs knows the struggle of finding a way to pay for health insurance.
I work, I don't, I pull my own weight, but I do have a child depending on me, so I'm working part-time and I can't get health care through my job, so I have to pay for it on my own, and it's tough.
Will allow for differential payments based on capabilities of the independent patients.
The reading of the bill began at 5 a.m. and is estimated to take about 16 hours to complete. Organizers planned the event because they believed Americans have become overwhelmed by the debate and need to take time to educate themselves on how it will affect their lives.
Even though it's written in a lot of legalese for lawyers to understand, common, everyday folks can read it and understand it and pay attention to what's going on, because this is one of the most important legislations of our lifetime.
Medical devices, medical and surgical procedures, and other medical interventions.
Pauline also hoped that the reading would inspire people to pause, discuss, and debate the health coverage issue, no matter what their point of view.
Section 1854G of the Social Security Act.
Or at least be inspired by the intelligence and enthusiasm of a well-informed third grader who wants life to be better for his family and his country.
I canvassed last year for Obama, so that really got me set up for the politics. And now I want to be president when I grow up. So.
The reading here in Scranton has gotten a lot of national attention. The word is it's also going to be duplicated in other cities around the country. Kathy Baczynski, TimesLeader.com.